So here I go in English and to talk about something that I think really needs to change. Healthcare services in Northern Ontario. Well, I'm going to probably say healthcare services all across Canada. Um, Yesterday, I wanted to make an appointment with the clinic where I am a patient. I spoke to a nurse on Saturday virtually by Lumino Health. It's a service by Sun Life. And because of symptoms I've been having for the past month or so, increasing symptoms of pain, muscular pain in my knees, especially, but also in my ankles, my feet, my forearms. And at first I said, well, it's going to go away. It's going to go away. Well, a month later, it's still happening. And I spoke to the nurse over Thanksgiving weekend, and she said, well, it's not something we can really help you with virtually. You need an assessment with a doctor or a nurse practitioner in the next 2 days. That was the recommendation. I said, well, I'm in Kapuskasing, Northern Ontario. So my option is to go to emergency. Well, she said that there's no walk-in clinic. There's no after-hours clinic. No, hell no. So, I'll take medication. I've been taking ibuprofen, 400 milligrams, and I've been taking Epsom salt baths. And you know what? It's not really relieving the pain. I don't know. It's not doing much to help the pain. So um, I call. I did say, well, I'll try to call my a clinic on Tuesday, when the office reopens, and see about getting an appointment as soon as I can. Um, And when I asked for an appointment at the clinic, I was told that it was not possible to have an appointment this week, even though I told them that I would need an assessment as soon as possible. They told me to go to the emergency department. Well, I don't know. I, I think this is an inappropriate suggestion. Uh, Visiting the emergency department is for true emergencies. It is for you're having chest pain, you have a laceration that needs repair, you had a work accident, you have diabetes complications, that's why you go to emergency. But if you have something that needs to be tended to in a couple of days, I think you should be able to go to an after hours clinic. You should be able to be squeezed in at your healthcare providers, not be told to go to emergency. And of course, and I had an exchange with a person there. I made a complaint and I got to speak to not a director or an assistant director even. I got to speak to a secretary who basically was giving me the la morale in French, that, I'm not special and a lot of people are having to wait and it's not unacceptable to wait until next Monday for an appointment. The thing is, maybe I am special, but I'm off this week. And I said, well, I could get this problem tended to this week. I could, before I go back to work, but I have an appointment next Monday and I'm back at work next Monday at 3 something in the afternoon when I have to miss work. I hate missing work. It's a pet peeve of mine. So, because they count on us, every minute counts at work and the kind of work we do and call center type of work, every second's got to be counted for. So if we're missing work, we're putting somebody in in not trouble, but it's inconvenient anyway. But it is what it is. Uh, anyway, so I was told I could make a complaint, file a complaint. But you know what? Having worked in healthcare services, I worked in the hospital world for 17 years in different roles and administrative roles. The last role in health records, and I know these complaints. They get file 13 basically. It's made just to calm you down when you're in a pissed off mood, but nothing much ever comes of it. There may be exceptions, but usually nothing is done about these complaints. I know this, and I'm not going to waste my breath doing it. But what I can do is tell people about it. Go online, tell people this is not acceptable. There needs to be something in between the the clinic where you're getting healthcare services and the emergency department. You should not be told to go to the emergency department for something that the clinic should be providing service for. Uh, there should be emergency spots or, urgent. I don't want to say emergency because that's not an emergency. It's something more urgent, but it's urgent, but does not require a visit to the emergency department. But that's what we do in Northern Ontario. This has been an ongoing thing forever here. We don't have a walk-in clinic. We don't have an after-hours clinic. So they tell us go to the emergency department, an offload of problems. That's where you go. And of course, are you going to get good service there? Well, you may, but you're going to get judgment. And it's sad. I don't, I've, and I know people that work there. I've worked in the hospital world. I know that people get hardened by working in an emergency department because of all the things they see. It's rare that a person maintains um, the empathy perhaps they should have, because it just isn't impossible, especially in the times we're living in now. Uh, an offloading of into the emergency of things that are not urgent, and that's been ongoing forever here. Uh, and it's not getting better, it's getting worse. And that's, the healthcare world, it's gotten worse over time. We have great things for screening, we have great uh, technology, but human evaluation is not getting better, it's getting worse. uh, you go into an office, you get assessed. There's voice speech recognition, listening to everything that's going on. If you give your permission, and they summarize the visit. Is it done correctly? Are you looking at all the things that they're documenting about you? Yeah, it's not cool. It's I've reviewed actually something else. After working in the hospital world, I reviewed medical information. I used to summarize medical information for a law firm uh, to help people win their long-term disability. So I know a thing or two about healthcare. I know that what's going on is not good. It's not acceptable, and somehow it continues. Um, what needs to change? There needs to be an in between. There is in between in other places where larger centers. You hear horror stories about people going to the emergency department and waiting 5, 7, 9, 12 hours, whatever. But that's not the place for them. It's not the place for us. We should be in a clinic, like an after hours and urgent care. That is not the emergency department. Oof. But again, we're dealing with so many problems and a shortage of doctors. Um, but here in CAP, we have healthcare providers, we have nurse practitioners, but I can't get an appointment this week, for example, and I'm told that to go to the emergency department, which I will probably end up doing. And I I just don't think it's right. I don't think and it needs to change. There's a lot of things that are wrong with the healthcare system. One of them, and I'm going to discuss it here too, is say uh, there's been an ongoing locum service in the northern communities. Uh, locum service is good to as a band-aid solution, but long term, it's been used for too long. Like doctors are not encouraged to set up practices because they can come to northern communities and have services, everything done for them. Basically, they just submit their billing to OHIP. Um, I'm not saying what they're doing; they're not doing easy work, but the system is making it easy for them to not set up a practice because of ongoing locum. Locum should be a temporary situation, not an ongoing 20-year situation or 30-year situation like we're living in Northern Ontario. Doctors should be after, locuming for 1 year. They should be setting up a practice. They shouldn't be locuming for 5, 10, 15 years. That is not cool. And it's going on. It's happening. I know I'm going on and on this morning, but all of this because of what I experienced yesterday and my experience with the hospital world, with the healthcare world, having worked in the healthcare for 17 years in administrative services and seeing and, as reviewing information, having feeling like quality matters in healthcare, but not having enough of a power to enact change in healthcare. I was told I went, 2 weeks before I stopped working at the hospital. I was 40 years old, and I said, I'm not going to live till I don't want to live just for retirement. I want to live now. And if I work for a longer time, so be it, as long as I enjoy more what I'm doing. Because I had the Sunday I worked Monday blues every friggin' week. And it had to stop. It had to end. I went through different jobs, different situations. I'm grateful for everything I've tried. I've learned. I've had some bad situations, some good situations, and I keep learning all the time. But I know that like when I left the hospital world, that's one of the reasons I was told 2 weeks before that to not expect that things would get better, that they would get worse. And this person was so right. It did get worse. And it continues to get worse. Not technology wise, but uh, human treatment wise. The way people are treated is getting worse. And how is that possible? We have the means to take care of people to help assist with technology, but we still need humans to actually provide care, provide assessments. And that is not happening right now. Like, it's horror stories, basically. When you're here, not just about these waiting times for me. I mean, people waiting months to see their doctor. 3 months, I've heard this in Northern Ontario, waiting 3 months to see your family doctor. And you cannot go to an after hours clinic or a walk in clinic because you have a family doctor. Imagine. You're screwed. Yeah. What else? Uh, we know in northern community like Hearst that used to have obstetrical services. That might change though. They do not have obstetrical services. Women in Hearst are told to go to Timmins or Thunder Bay when they're expecting. They're about to have their baby, even sometimes months before having their baby. In what universe is this acceptable? It's happening. Of course, it's not, the doctor that provided the service before stopping it was burnt out. And this happened. He was covering the service for 5 years on his own. So he was put in a situation where he just couldn't anymore. This is what happened. There's nobody to take over. You don't need just one doctor providing obstetrical services in a community like hers because they are covering a catchment area. They are covering Hornpain, Matthijs. Yeah, people from Long Lac Geraldton would come to hers to have their babies. So yeah, it was not thinkable to have one doctor take care of all this. Lots of shit, I'm going to say, bad in Northern Ontario about healthcare. Can it get better? Of course it can get better. But we have to encourage doctors to set up practices. We cannot continually encourage long-term locum services. That is part of the problem. After a certain amount of time locum, that would be it. You can't locum forever. I'm sorry, it's a problem. And it has been here in Northern Ontario, a long-standing band-aid that is making the problem worse over time. I know I've spoken long, and I had a lot of things to say, and I'm going to be sharing this on different social media platforms. And those that listen, well, thank you for listening. I'm pissed off, and I'm not the only one.